Welcome to the reALLERGIES podcast, a show exploring FPIES through real conversations with patients, parents, and clinicians. This episode is brought to you by the International FPIES Association, the leading global advocacy organization for food protein-induced enterocolitis syndrome. This podcast is for informational purposes only and is not medical advice. Always consult your healthcare provider. The views shared are those of the host and guest. The reALLERGIES podcast is proudly sponsored by Genentech, a leading biotechnology company dedicated to advancing science and improving patients' lives, doing now what patients need next. And now, here's your host, Fallon Schultz.
Good morning and welcome to episode 3 of the reALLERGIES FPIES podcast, bringing you the perspectives of the patient, parent, and clinician. We're so excited and thankful for the feedback that we've received so far on our first and second podcast. And we're really excited to be able to give you a backstage pass and a little bit of a different angle in episode 3 and 4. This morning, I'm joined again by the queen of FPIES herself, Dr. Anya Novak-Vedjan. And many people will be saying, where's Landon today? Landon is actually at practice for baseball. He sends his regrets, but he will be featured in later portions of the podcast of episode 3. So good morning, Anya. How are you?
Good morning, Fallon. Good morning, everyone. I'm good. Thank you. I'm so excited to be here with you, even without Landon. You know, body is important as much as spirit, so go Landon.
Yeah, go Landon. Well, I'm really excited to be here with you too. I know that we are coming off of a very, very busy end of February, beginning of March. And so I thought today we could talk a little bit about the Super Bowl for food allergy, as I like to call it, which is the American Academy of Allergy, Asthma, and Immunology annual meeting. Anya, Landon, and I attended this conference, and we've been attending this conference. I mean, I've been attending it for 15 years. How long have you been attending this conference?
Oh, much longer, for at least 29.
Wow.
29 years, yes. As a fellow and then as a faculty, I think I missed 1 or 2 for like health reasons, or it's the most important event of the year for the professional allergy community, the largest professional organization of allergists, immunologists in the US and probably in the world.
Yeah, I agree.
And the meeting is really amazing.
It's intense. It's very intense.
Loaded. It's loaded.
Yeah.
The newest research and clinical developments and new drugs, everything you want to learn.
In like 4 days. So I have a whole different appreciation for clinicians and researchers after having not just the opportunity to exhibit and have an IFPIES booth in the exhibit hall, but also to have a seat at the table where literally this is the development and formation of conditions like FPIES, as well as where the decision-making occurs on guidelines and research and all of the minds and the powers that be are at this conference. And we gear up for months to prepare for it. And then we start at like 5 a.m. There's one meeting that we start at 6 a.m. in the morning and we're not stopping until 2 a.m. So that's a nice segue. Anya, would you be able to share with our listeners a little bit about the Adverse Reactions to Food Committee and the FPIES work group that you formed and created many years ago, and how that's really elevated to get us to where we are today, as well as some of the updates in that work group report?
Of course. Adverse Reaction to Foods Committee is the single largest committee within the American Academy of Allergy, Asthma, and Immunology, or as we call it for short, QAAI. It's incredibly popular, and this reflects the interest of the community in food allergy. And probably 15, 16 years ago, we've created, and within the committee, there are subcommittees, or as we call them, work groups. And we have created the work group on FPIES, which then evolved into non-IG mediated food allergy, encompassing other conditions, right? Not only FPIES, but also proctocolitis and enteropathy, but mostly FPIES. And this is a very big committee and work group, and it's incredibly productive. And
I think it's the most productive, but I'm biased, so.
yeah, well, I mean, it's definitely impactful because the work group report was the first
Massive.
it was the publication of the first guidelines, which
Yeah.
you know very well because you were the driving force behind that in 2017. So currently we are gearing up for an update for the guidelines, and the members of this work group are doing really fundamental work, doing a research on literature review, systematic literature review, which, you know, we have to scroll through all of the published articles that mention FPIES and then decide which are relevant, which are not relevant, and then form a base, kind of evidence base, to formulate the recommendations for the clinicians, because we recognize how much the field of FPIES has changed, how many more patients we're seeing, how different the allergens are. You know, there's a need
Presentation.
for evolving guidance, right? And we
Mhm.
also are much more aware of adults with new onset FPIES. Um, and there's not a lot of out there to guide primary care clinicians how to support those patients. So it's really chasing a moving target, really, in a way. We grow with FPIES, and every year at one of those 6 a.m. meetings, we deliver the
We all come
report,
with our
you
hair
know, by
wet
the
and just like in a
activities.
fog. And
Um,
Anya walks up and pulls the scroll out, and like it just rolls through the back of the room, and she reads off of all of her
yeah,
accomplishments and everything that's being done. It's literally like that.
yeah, yeah. No, it's really energizing, right? And it's empowering to be there and see how much interest we get and how much attention. And we have, you know, reported on the activities, as I mentioned. The guidelines year up with the systematic literature review. We were lucky to secure funding from the Quad AI for a biostatistician support for meta-analysis of the data that we have gathered. And we also reported on the webinar that we have been able to deliver, FPIES Pearls of the Podium, hosted or moderated by Fallon. And this was through the Academy on January 26, 2026, which was, we were really incredibly happy and grateful because there's so many allergists in attendance. Fallon, you may have more recent numbers, but I know that it was, at the time when I was looking at the screen, it was over 100 people,
Yeah,
including the president of the Academy, which he told me, you know, afterwards, that he attended and he was, you know, very interested. So another activity that it's ongoing is we are working on integrated clinical care pathway for FPIES, kind of FPIES toolbox for clinicians, recognizing that we have some special expertise that we would like to share with the allergists in the community, and you know, help them guide patients, and what are the critical elements of the visit, guidance, when to refer to dietitian, when to refer to a psychologist, or you know, refer to gastroenterologist. So this is an ongoing work. Another project that we are very excited about was led by Dr. Sarah Anvari from Texas Children's Hospital at Baylor College. We have now officially been accepted as a rostrum, so opinion manuscript, at the Journal of Allergy, Clinical Immunology in Practice, about standardizing oral food challenges for
yay!
patients. Yeah, so there's a lot of different protocols. There's a lot of confusion, how to do it, how much food, how long to observe, put the IV, not put the IV. So this is a very practical guidance, providing, you know, amounts of food, specific foods that clinicians then can use. To date, we were using this formula that you can use between 0.06 to 0.6 a gram of protein per kilogram body weight, not to exceed 3 grams. You know, it's just not very friendly for a busy office, trying to calculate that you have to know the protein content in a specific food. So So this is super exciting. I think this is going to be a really blockbuster for anybody, for us, and also a huge, wonderful resource for clinicians taking care of patients with FPIES.
Thank you for that update. It's so important. And I think sometimes from the parent and patient and family perspective, there's this overall feeling that nothing's being done or not enough is being done. And
oh my goodness, there's
I
so
mean,
much being done,
right,
so much being
right.
done. But well, I mean, I can understand we're behind, right? Like we are lagging behind. We're catching up. We're playing a catch up, right?
Yeah.
There, the clinical, the FPIES clinical development of FPIES kinds of is ahead of us. We are,
Yeah.
those initiatives takes time, right? Take time.
Yeah.
But I think we are doing a lot. We are,
Yeah.
in addition to that, we are going to be looking into immunotherapy for peanut FPIES that is now becoming much more common. There's a little small grant that was issued by National Peanut Board.
Yes.
We are going to publish, a FPIES action plan for both pediatric and adult populations. Dr. Teresa Binkeman from University of Rochester has created an educational content on adult FPIES for Medscape, which will allow for reaching a large number of physicians who are not allergists to make them aware, to raise awareness. And
Yes.
I want to clarify the FPIES emergency treatment plan. It is available on the fpies.org, right,
Yes.
for you to use, but we are kind of tweaking it, fine-tuning it, and want to have it get official kind of blessing of the Quad AI for that document. It kind of elevates, right, the importance or the
It makes it synonymous with
right.
the anaphylaxis action plan that is very well known in IgE-mediated food allergy, and I
Right.
think that's important, right? And that was one of the reasons why this was so important. Was we've seen a lot of parents that either enroll their children in daycare or in school, and because their child doesn't have IgE-mediated food allergy, sometimes they're denied admission or enrollment, or their symptoms are dismissed. And we recognized that we needed to have an action plan in place so that, and some of these patients have IgE and FPIES, right?
Right.
So we needed to differentiate between the two. And I think that's like the greatest part of that document is it explains the differences so that the patients and the families are not met with having to further explain what FPIES is and prove their case or be denied admission to school or daycare. So it's important, and that stamp of approval, I think, is going to help to disseminate it in a much bigger way so that if you are a newly diagnosed patient, whether you're a pediatric or adult patient, this is something that would be brought into the clinical algorithm and strengthen the unmet need with the patients and families.
Absolutely. And another reason that this plan is so important is because frequently when you say food allergy, right? Like,
Yes.
oh, where's your EpiPen? Where's your Benadryl? And then the parents had really difficult time
Yeah.
explaining why they don't provide Benadryl, they don't provide EpiPen because they don't do anything, right? Like they are
Yeah.
other, if you are having both or conditions or atypical FPIES. So it is, I think it's going to be it is very helpful. It
Yeah.
already is.
We've
But
gotten so much positive feedback from it, and I'm always kind of circulating it on the website, and we had it at the booth at Quad AI as well, and it's a game changer. I feel, I wish I had something like that back in the day of the dark ages, but it's a game changer. So it's great that the goal is to move it towards publication.
yeah.
Okay, so we decided to take a different angle with this podcast. And so what we did was we filmed multiple interviews. We captured the late breaking abstracts that were being presented. We had discussions with partner organizations, with social influencers. We're going to be teasing out a lot of really cool information. So everything that Anya shared, it sounds so like beep, 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 like, oh, it's just nothing. But these are pivotal, massive initiatives that take years. I mean, when we worked on the initial publication on the guidelines, it took us 3.5 years. And the guidelines were published in 2017. And just to kind of piggyback on what you were sharing, there's a lot of changes in FPIES. And so I just want our listeners to know that we are aware and we recognize that even, the low, moderate, high risk chart needed modification. We needed to strengthen the adult FPIES area. That we're aware. And we're working in the background, but as Anya shared, there is a system to this, and there's a way that it needs to be done to ensure that the data that's included to shape the guidelines is validated and credible information. And a lot of the times when I talk to patients and families, there's a lot of misinformation on FPIES. And part of what we're really working very hard to do is debunk these myths, because I personally see a lot of patients and families, pediatric and adults, needlessly suffering. And there is information that is credible. There are guidelines in place. The clinical pathway piece that Anya shared is really important because it's a way that we can standardize how clinicians are conducting initial intakes or how they're making after summary discharge summaries and providing patients and families with resources like Lonnie's Lounge telecoaching or the emergency action plan, so that you're not having to go out into the interwebs, into the trenches to find information and be misguided or end up in very well-intended places that maybe have a lot of misinformation. And that's twofold, right? We recognize that that's not just in the patient and family realm, it's also in the clinical realm, right? There's a lot of knowledge gaps. There's a lot of unmet needs. And so how we pair that is with the other programs that we're launching, like the consortium and the journal club, so that we can educate primary care, allergy, emergency departments, gastroenterologists. And, Anya, you've done such an incredible job of pioneering and spearheading these initiatives and bringing, the key opinion leaders and the experts in this space from all over the globe to really put their eyes on these different initiatives and make sure that we're capturing not just what clinicians think and experience, but also what the unmet needs and the voiced concerns are from the patients and families. And I think that's what makes this so unique. And I'll end, kind of on this note. I'm so glad you brought up the oral food challenge, because we get so many emails, not just from patients and families again, but from clinicians that are, especially in the adult space, they don't know how to do challenges. And I think that this document and this formality is going to be game changing in terms of standardizing how oral food challenges can be conducted or will be conducted, and providing the reassurances that this is built around safety first. And the recognition that we understand that some patients need multiple exposures before they have a reaction. Some react to very small thresholds. Right. And that's what makes it difficult to standardize or to develop a one-size-fits-all protocol. And I really want to shine a light on why I think this group is so impressive, is that we don't just think of what's great for the general, population. There's consideration of those outliers, and they're brought into the folds. And we have these discussions of how can we make sure that everyone and anyone, depending on your age or your severity or multiple food or comorbid conditions, are included in the dialogue so that we can be able to provide support and help to everyone. And Anya, you're a champion for that. And I thank you, because it's very difficult already to be in the food allergy space and to not be an IG-mediated patient, and to be in the FPIES realm, and then also be an outlier within the FPIES community. It's very difficult, and these families really have a hard time. Patients have a hard time. So I'm grateful to you for spearheading that and always making sure that it's inclusive.
Well, we wouldn't be here, without your efforts and passion and conviction. So I just want to say that I think as clinicians, we always want to do right by our patients. Sometimes we don't have the time, or there are competing priorities. So that toolbox that we're creating the ultimate goal is to really improve the care of the patients and improve access. So, there are several big centers in the country that they're experts or around the world, right? That have experts in FPIES, but a lot of patients don't have access to those centers. So having the toolbox will be incredible. It will be critical, right, to provide the optimal care. And then, as you mentioned, the food challenge. We want to increase access. We want to kind of guide the clinicians to empower them to offer those challenges, right? So you don't have to wait a year or 2 or 3 and travel across the continent.
Right.
I have patients from Washington State who come for the challenges because they don't have anybody local who is feels comfortable offering the challenge. So the mystifying, right? The mystifying, but also making sure that patients who really have severe manifestations, they're safe. As you said, safety first. And this will always be our most important goal for taking care of patients.
Well, thank you for everything you do. Thank you for sharing the update with our listeners. And so, as I shared, what this podcast, this episode 3 and 4, will lead into the interviews. I will forewarn everyone, there's a lot of content. So you can watch it at your leisure, but we really wanted to take the opportunity when we were in a location where everything is buzzing and bright and exciting, and not delay getting that information to our listeners. So stay tuned. There will be links on fpies.org/podcast to the interviews. You can watch them again at your leisure. And I just want to thank everyone who was there with us at the FPIES booth, the board of directors, all of the contributors to the interviews, everyone who contributed to the science and literature and advancing FPIES, and supporting, our organization and what we do. We would not exist if we didn't have the support of the Quad AI and of our medical advisory board, and our board of directors, who really are passionate advocates all across the board. So we hope you enjoy the interviews. We would love your feedback on what topics you would like for us to present on. I've already gotten some requests for egg and milk ladders and Generation FPIES, kind of bringing in our Generation FPIES team and speaking from all of the different ages and experiences. But we would love to hear from you. You can send an email to contact@fpies.org with your requests. And this will be a 2-part series for the month of April. So we'll have episode 3 and 4. And then in May, we'll have some new content. So thank you for joining us today. We wanted to keep this a little bit shorter so we can lead into the interviews. And Anya, thank you for your time today. And we're going to keep rocking and rolling.
Absolutely. Do you want to say something special about May?
Yes, I do. Thank you for reminding me. How could I forget? Probably because we're so busy, right? Well, I'm glad that Anya brought that up. For those of you who do not know, we have a congressionally recognized National FPIES Awareness Day. It is the only congressionally recognized FPIES Awareness Day on May 4th. And the reason we chose May 4th is because May in and of itself is Food Allergy Awareness Month. And each of the different types of allergy have some, like eosinophilic week, there's a whole week dedicated to it. So our day is May 4th, and you'll be seeing, if you're following us and if you're receiving our e-newsletter, you're going to start getting information about the Take a Seat for FPIES campaign that we're running. And that will be in the e-newsletter. So if you're not subscribed, go to fpies.org, scroll to the bottom and subscribe so that you can have access. We do a monthly newsletter. But May 4th is a special day, and we worked really hard. We worked with the lobbyists. We went to the Senate. We had bipartisan support. There's a lot that goes into creating official awareness days. So anyone who's out there and listening, share your story, elevate your voice, throw up, our awareness ribbon, which is teal, which is the color for food allergy, with a shade of gray, because that's how we feel about FPIES. There's just this shade of gray. And we hope that you'll join us in celebrating on May 4th. So thanks for that reminder, Anya.
So
geez, we're kind of an advocate, am I? And I'm not even announcing our awareness day.
I remember taking a pie in the face for the first
I think
FPIES.
we should bring that back, right?
Yes, let's bring.
Yeah, so we had a campaign years ago where we took a pie to the face for FPIES, and it was a challenge. And I have a beautiful, I might have to post it on our socials of Anya and Dr. Scott Schuster at Mount Sinai pieing themselves. It was a good time. I think we should bring it back. Let us know.
Yeah, let's do it. Let's do it.
Let's do it again.
That's so fun. All right.
Yeah. Well, thank you again for joining us, and we will see you soon. And thank you again for listening to reALLERGIES, the FPIES podcast.
Thank you all.
We're super excited to be coming to you from the 2026 American Academy of Allergy, Asthma, Immunology meeting. Here at FPIES, we've been very, very hard at work to be able to launch new programs and to develop resources that actually reflect the lived experience, coupling that with the education to clinicians to have our voices heard and to ensure that we can actually improve patient outcomes. So I'm going to give you a little tour of our booth. We're here today at booth 1517 and share with you some of the new materials that we are launching, which will also be available on our website at fpies.org. So first, we're going to start with the FPIES Emergency Action Plan. I like to think of this as being very synonymous with the anaphylaxis action plan. And a lot of the times what we have encountered is patients and families with FPIES will enroll their children into school or into daycare, and they do not have an action plan that reflects their symptoms. And so together with our medical advisory board, we created an action plan that addresses the symptoms from the gut, skin, heart, and other perspectives, as well as what to do in the event of an accidental exposure in these settings. It also provides medication dosing with the use of ondansetron, which is a medication that stops the vomiting and is documented within the international consensus guidelines for FPIES. We provide the information for healthcare providers and nurses, and also ensure that we're providing education to school nurses or to other caregivers who might be treating or managing or caring for a child or an adult with FPIES to differentiate between FPIES and IgE-mediated food allergy, because there's a lot of confusion about that in our world. So we wanted to make sure that we provided a nice chart that separates the symptoms so that our patients can get the care that they need. This is available on fpies.org under resources. We are very, very, very excited to be launching a updated version of the low, moderate, and high-risk foods that are evident in the consensus guidelines. What we have learned over the years is that first foods of introduction tend to be the most common trigger foods. And we're starting to see a shift now in from 2017 early introduction guidelines for IgE-mediated food allergy to our common triggers now becoming those top 9. So we at the organization tasked our amazing registered dietitians on our medical advisory board and asked them to provide an update in terms of what are we seeing now in the patient population and in academic centers so that we can give a guide to help patients and families navigate food introduction. And so what's beautiful about this new chart is not only does it give us the list of the low, moderate, and higher risk foods, but it also gives guidance on ensuring that patients from 0 to 4 months, 6 to 8 months, 6 to 9, and 9 to 12 are meeting their ages and stages in oral development and what that needs to look like from textures, different taste profiles, so that we can intervene early on to prevent the onset of food aversions or oral motor delays, so that patients have a positive experience with food. In addition, there's an algorithm to help clinicians determine if there's a lower risk or a higher risk food and how to do challenges. There's a lot of new theories around, is it better to do smaller doses once a day or to titrate twice a day? And this new chart gives guidance in terms of how to do that. Of course, this should always be a shared decision making between clinician and patient and family. But in addition to that, it should be done based on clinical history and severity of symptoms. The most important piece when we're working with food introduction is to ensure that our patients have safety and that emergency management is in place. How do you feel about all this?
Feel great.
Next, my baby, Lonnie's Lounge. I thought I would tell the story of Lonnie's Lounge and how this platform came about. For those of you who don't know Dr. Alan Stillerman, he is a allergist who is recently retired, and he worked out of Minnesota. And every year I would come to Quad AI conference, and Dr. Stillerman would always come to the booth and ask questions and advocate for his patients and share with me their struggles. And over 15 years, we developed this wonderful professional relationship. Sadly, Dr. Stillerman's late wife, Lonnie, was diagnosed with pancreatic cancer. And during this time, Dr. Stillerman was on sabbatical, and he had reached out to me and asked me if I would work with his patients and give them support as they navigated FPIES, because he's such a genuine and caring human being, and he didn't want to leave his patients out there in the trenches alone. So for about a year, I worked with these patients and families and bridged their care and provided support, and the organization provided an infrastructure to support his practice. And after the passing of Lonnie Stillerman, Dr. Stillerman came to the organization knowing that it was always a personal dream of mine as the CEO to develop a telecoaching platform. Dr. Stillerman has provided the sole funding for this platform, and that's how we're able to offer Lonnie's Lounge free to patients and families. And it's a place that you can come to talk to someone who's lived it, who understands it, who has 17 years experience. As you've been watching our podcasts, you're aware that Landon and I have been managing FPIES for 17 years. Landon had FPIES to 32 foods. So we really had to learn skills and to develop techniques to be able to make this not only manageable, but enjoyable and fun, and thrive through the process of living with FPIES. And so Lonnie's Lounge is a place that you can come to have support for the practical management of FPIES. We can bridge your care. We can connect you with FPIES experts all over the world. We are able to help you to shop, to dine, do live cooking. We can virtually food shop with you and drop food into an Instacart, have it delivered. We could set up time management, and we guide you through a model called the Avoidance, Advancement, and Maintenance model, which I'll share a little bit later. It's a place for you to come and be yourself and share your story and get real practical guidance. And it is through the benevolence of Dr. Stillerman that we're able to offer this complimentary, and you can have as many appointments as you would like. So we're launching some of our materials on this platform in the hopes that clinicians will begin to refer their patients so that they can have the support, because one thing that we know about FPIES is the acuity of symptoms happens maybe 5 to 10% of the time, but living with it and navigating the real world occurs 90% of the time, and there are no resources to do so. Now there is. And so we're excited to offer this to patients and families, pediatric patients and adult patients, and to ensure that they get the care that they need. You're witnessing reALLERGIES, our new podcast, and this podcast is going to reflect the perspective of the patient, the parent, and clinician. And so on this podcast here at Quad AI, you're going to actually see some of these perspectives, and we're going to give you an intimate look at what happens behind the scenes. Oftentimes I have found, in chairing and working through IFPIES, a lot of our patients and families don't know what's going on behind the scenes and how much work is being done, not just from our organization with launching our programs, but also how we're shaping research and policy and legislation and all of the different pieces of the FPIES puzzle and addressing it in its full entirety. I like to say it's the macrobiome of FPIES. And so we're here today to bring and share that perspective and give you the intimate touch point with what is really happening to be able to move the needle forward. We're not stagnant. We're not sitting still. We're running forward. We're making strides. We're doing great work. You, as patients and families, the more that you connect with us and share your stories, we take your stories and we bring it to these conferences and sit at tables. This morning, I just attended the patient advocacy organization meeting with the board and the incoming president, Dr. Carla Davis, to share some of the issues that we're facing in FPIES, especially with some of these changes we're seeing with early introduction. And it was so well received, and we were so lucky to be in that room with our sister and cousin organizations in the allergy advocacy world and to work together to see where we can pair our resources and improve patient care. So the biggest initiative that we're launching here is for clinicians, because this is a clinical conference. And part of what we do that's very unique at the International FPIES Association is we're the only organization in the allergy space that is for patients and families and providers. And if you've lived with FPIES and you've gone and you've seen pediatricians and allergists and gastroenterologists, you know how difficult it is to gain access to an FPIES expert. And so over the years, I personally have become very frustrated with this. And through our partnerships with the Academy and the college and all of the global work that we are doing, we've decided to finally formalize and launch one central hub called the FPIES Global Clinical Consortium. And this is going to be a place where your clinicians can be educated on the most up-to-date information, have access to continuing medical education units, have access to our FPIES Journal Club that is run quarterly, where we feature late-breaking abstracts and new publications and engage them in conversations directly with the first author and researchers to be able to elevate the education and awareness around the disease and also stimulate and network to be able to come together to address this condition in meaningful ways. So the FPIES Global Clinical Consortium is also free of charge to clinicians. And we're launching this here at the Academy meeting. We're very excited. It's been very well received. And the consortium features everything from therapeutics to oral food challenge centers and who can see patients via telehealth. For those of you with adult FPIES, identifying allergists who see adult FPIES. And this will bridge into Lonnie's Lounge. So we would be able to take this information and bridge it in to make sure that patients and families have access to the support that they need and access to clinicians who have been trained and have access to our consortium, working directly with our co-chair, Dr. Anya Novak-Vegin, and our clinical director, Dr. Mary Grace Baker of Mount Sinai. So this is really an incredible opportunity for clinicians. We wanted to offer it free because it's quite costly for them to get their continuing education units, to attend conferences. This is all available virtually. Some of the program offerings are access to all FPIES presentations, breaking publication summaries, video coursework, CME and CEU webinars, FPIES guidelines and protocols, so protocols on oral food challenges, customized patient education handouts to make sure that patients have access to meaningful resources at their appointments, quarterly journal club meetings, open grant and research opportunities, and stimulating listserv discussions. So being able to bring all these clinicians together in a positive manner, in a way to educate, in a way to have meaningful discussions so that we can improve patient care. And last but not least, we're really excited to share, and I'll be honest, this is a model that I've developed from working with patients and families over the years. I like to call it the AM model because I think food challenges are most effectively done in the morning so that we don't run into reactions in the evening. But the AM model, avoidance, advancement, and maintenance model. And basically what we do is we work with families in a shared decision capacity to help them navigate not just only food introduction, but reintroduction. And this is where so much anxiety lies, and this is where the guidance is so poor. So what we've developed is a model that we are suggesting to clinicians that they can use to get the appropriate information to understand your lived experience and the challenges that you face in terms of how to introduce foods. So the first step is emergency action plan and ER letter. Nothing should be done until we have a solid plan in place in the event that there is a reaction. And that's pairing our FPIES action plan, the ER letter that's on fpies.org, and making sure that patients and families are familiar, even adult patients who don't know that they can have access to an emergency department or access to ondansetron. Second, the second piece of this is to identify freebie foods. Remember, FPIES is food protein-induced enterocolitis. There are foods that do not contain protein that are freebie foods, like salt and pepper and sugar and baking soda and baking powder and certain oils. And so when we can arm our patients with this tool and teach them, hey, we have these options to work with to build taste profiles and to be able to create sweet and savory and salty, it kind of helps to reduce some of that anxiety and also give you a nice jumping point. Next, the first question that I always ask on Lonnie's Lounge when I work with a patient and family, and I feel like it's the most practical question that we can ask, is what do you and your family like to eat? We should be guiding food challenges based on what you eat in your home. What do you like for breakfast? What do you like for lunch? What do you like for dinner? What do you like to eat for snacks? Once we get that information, obviously in FPIES, if we have, milk and soy and wheat and note that we can't eat our egg, that is challenging to make those meals. But we can guide you for any food that you need to avoid. We immediately need to find a substitution. So we like to make a shared decision-making plan and then help you to get to a place where you can have social integration at meal times and eat meals that you prefer. Lastly, we like to make sure that patients and families have continuity of care. So before you even start to introduce foods or go through the reintroduction process, ensuring that patients have access to something like Lonnie's Lounge, so that when you are struggling, you are dealing with fear and isolation of FPIES, you are not ready to do food introduction, or maybe you're just, not used to cooking foods and time management is difficult. We can handhold and guide you through that process to make it easier. So the way the avoidance, advancement, and maintenance model works is any food that is a fail ends up in the avoidance bucket. And immediately what we do is we look to see, is this a staple in the diet or is this a supplement? So for example, avocado typically is a supplemental food. So we can work around that. Maybe that's not the priority to find a supplement for. But when we're dealing with foods like dairy and egg and wheat and oat and rice, instead of avoiding those foods and putting the emphasis on having to deal with the avoidance, we need to find the replacement because they are staples. So a great example is dairy. When we have children that are reacting via breast milk or children who are reacting via milk-based formula, and we're getting to a year old and we're looking for transition, we need to find other milk sources that we can supplement. And so I will work with patients and families to identify different options, and then it's a shared decision making with their clinician in terms of how they should be introducing. So let's say we settle on, hey, we want to try coconut or almond or pea. We then move those foods into the advancement bucket. And then it's a shared decision, clinical shared decision making decision of, is this food being trialed at home or is this food being trialed in the clinic? And that's something that you work with your clinician on. Once you trial that food and pass that food, and I'll use coconut as a great example, we then move it into maintenance. And then that's where, through Lonnie's Lounge, we get really super creative. How can we take coconut and turn it into multiple foods? Well, coconut is a versatile food. So we have an oil, we have a flour, we have a fat, we have aminos, we have lots to work with, and we can help you to build recipes and to be able to cook and freeze foods so that the time management is not so overwhelming because, let's face it, and I'll admit it, and my son will admit it, underneath this booth is lots and lots of food. So we did a lot of meal prep to get here. So I understand it, but we want to cut that down so that parents are not over functioning and parents are not living in a constant state of hypervigilance, and neither are the patients that are living with this condition. We want to simplify it, and we want to make sure that when families or adult FPIES patients are sitting at a table, they are included. They are eating what is normal for their family. They're not eating in doses. They're not eating isolated. And that's what the avoidance, advancement, and maintenance model can do for patients and families. So today I'm here with Mia Silverman from Latitude Food Allergy, and she's here to talk to us about her experience of living with 50 food allergies. And as we know, in our patient population, a lot of patients have multiple triggers, and that's really complicated and really difficult to live with. And it's always important for us to get the perspective from the entire bird of food allergy. I kind of always say that, our two wings need to flap together, the IgE side and the non-IgE mediated side. So thank you for joining us on our podcast. Tell us a little bit about yourself.
Yeah, so my name is Mia Silverman. I'm based in New York. I'm from Boston, Massachusetts originally, and I am a master's student in clinical psychology, and I'm also a food allergy advocate and influencer known as Allergies with Mia on all social platforms. I pretty much just showcase how I navigate living with over 50 allergies, showing how I travel, how I, go to the restaurants and order at restaurants, how I navigate even being a graduate student, just how I live my life with all these allergies and showing that you can live a very fulfilling and enriching life.
That's amazing. That's amazing. And you're having such a big, huge impact in this realm. And it's so important because I think there's such limited guidance in how to navigate food allergies in the real world. We have great clinical implications and suggestions, but that doesn't always translate into the real world. So tell us a little bit about some of the tips and things that you've learned along the way and how to navigate being out socially and where those knowledge gaps are between the clinical recommendation coupled with what it's like to actually live with this.
That's a really good question. I think the first thing is that learning to just own your allergies and not being embarrassed of it. I feel like it's such a hard mental loop to go through, but I'd rather be embarrassed for 5 minutes while ordering for my allergies instead of ending up in the back of an ambulance and having to pay thousands of dollars for a medical bill. And so learning to just kind of embrace these allergies, because honestly, for me, I've been told that I'm going to have these for a very long time. There's not really a cure for food allergies. I mean, I'm going to be doing OIT in 2 months, so hopefully
that's wonderful.
I'll be able to eventually outgrow some of them. But for now, I'm going to be stuck with this I've had it my whole life for 22 plus years. So I've learned to just kind of accept it, embrace it, and also just view it as a way to kind of help me become more creative when it comes to cooking. For example, I've had to learn how to make, my mom especially, my mom's a great cook, and she's had to learn how to make all these different types of meals that are allergy safe. So kind of using your allergies to your advantage. I feel like being an allergy advocate and advocating at a young age is a really important skill to have, because it's how you keep yourself safe.
So Mia, I actually am you're such an incredible example of how to live with this. And Landon is also on our podcast, and Landon actually had FPIES to 32 foods. So you too really understand the complications and the everyday challenges. And so, from both of your perspectives, what are some tips that you would share with individuals who have multiple food allergies, things that have been helpful, tips of the, tricks of the trade that you have learned in a way that creates inclusion and gives you the ability to eat safely with modifications?
Do you want to go first?
Oh yeah, I could go first. So I know for people with food allergies, especially for me when I was younger, eating out with my friends has always been an issue because I can't have what they can have. And I was always nervous to have to bring food out because I'd feel excluded or out of the ordinary, but don't hold back on it. Even though you have these allergies, you shouldn't hold back on anything because you still are who you are and you can't really change that.
That's great advice.
I love that so much, and I agree. I think just everyone has something they're dealing with in their life, and I guess for us, it's having these restrictions.
Yeah.
And I think just learning that it's it doesn't define you. You can still live a really fulfilling life as long as you are prepared. And for example, eating out, calling restaurants ahead of time, making sure you have your epinephrine or your medication with you. You'll feel more empowered because you are prepared. So I think just always kind of planning a little bit ahead, so you don't have to worry about those potential accidents that can go wrong.
What's interesting is we're here at a conference and none of us live in Philadelphia, right? So can you share with our viewers what it took to get yourself here with your safe foods and the prep that maybe took place in the background? And if you want to share what's going on even underneath our booth, that would be great. So share, how did you get here today? What kind of prep did you have to do? Are there certain products or equipment that was helpful for you that you would suggest to patients and families that maybe have to navigate bringing food, or parents who are I have to carry a bag everywhere? Some of those pieces, if you want to share.
So we are based out of New Jersey, so it's about an hour and a half drive for us. And for me, I pack my food the night before. My parents usually make it for me, thankfully, but we always have to pack it the night before, and then we have our hot cold bag, of course, which I keep in my bag at all times with all my food, because I packed dinner and lunch today not knowing if we'll be out late. So the big part is really just being prepared, bring all your medication just in case anything ever happens, and pack accordingly.
Do you want to share a little bit about the thermos? So some of the things that we found over the years that help.
Oh yeah, of course. So we recently just found a new thermos. I wish we had that when I was younger for when I was having lunch with all my friends, but it's basically like a 3-stack thing where you could add smaller things and bigger things in the bottom, and it'll help me add more into my lunch or dinner, whatever it is, and it's been pretty helpful so far today.
How about you, Mia?
So awesome. for me, everything that he does or you help with him, I agree. I also have a very big breakfast in the morning because I don't know, like in case my food kind of goes bad, because I feel like when you bring food with you that's like kind of hot, it gets kind of mushy and gross. Like, you know, have like a big breakfast.
Temperature
just in
control.
Case. Yeah, I bring lots of snacks too. And I always carry my epinephrine, my Zyrtec, all my medicines with me because in case of an emergency, I want to be prepared. And I also have like my parents like have my locations. They know where I am in case there's an emergency, God forbid. So there's always like people let you know like where you are. I think it's also important.
And I can share from the perspective as a parent, we also are very selective of which hotels we stay in. So I always ensure that wherever we're staying, there's a kitchenette. And of course, that's an additional cost burden for our family with food allergies, which is a whole other aspect, right? It's not cheap to have food allergies. But making sure that Landon is comfortable where he's staying and sleeping, and he doesn't have to navigate looking for a way to heat his food or where he can keep his food overnight, that it's easy grab and go so that it translates just like we're at home. And that's another element that I think often gets missed, like in the clinical realm, is teaching families like, okay, if you want to travel, you can do it. Here is the list of how you can actually make that happen. Here are some products that you can use to keep your foods warm or cold or preserved. Here are some items that you can use to transfer your foods. And that's a lot of what we do on our telecoaching platform, is help patients navigate that. So it's so great to see two individuals, amazing individuals, who have not just navigated, but are conquering and slaying IG-mediated food allergy, non-IG-mediated food allergy. And we hope that this can show you that this can be done. We're all sitting here at this conference, and yes, maybe under the booth there's a ton of food in a hot cold bag, but guess what? I think you're having fun.
Definitely.
Are you having fun?
Heck yeah.
Yeah, we're all having fun here, and there's a sense of normalcy around this. It's so important that we help patients and families live normal lives. And I don't even like the word normal. I like thriving, exceptional, fun, creative. I think what this demonstrates is living a normal life, but like, I hate the word normal. I just find it to be a little degrading.
Yeah.
What we want to teach is how to thrive, how to have fun, how to make this exciting. And normal is too low of a baseline for us, right? I just don't like the word. What do you feel about that?
I feel like normal, what does normal even mean? I feel like nobody lives a normal life. I think normal is very subjective. I think just live your own life and on your own terms and keeping yourself safe is to me what matters. And thriving. I think the word thriving is beautiful. It sounds really empowering. Yeah. I think that sounds better than the word normal. Normal is also just kind of boring. Why do you want to be normal?
It's a boring baseline.
Yeah, I'm not into that. How about you? What do you think?
Yeah, you don't want to associate yourself with everyone else. You want to be your own person, and being normal associates you with everyone else, and it doesn't have your own story behind it. So, like we said, normal is not the right word to describe everyone.
Yeah. Well, I think the two of you are anything but normal. You're exceptional. And I'm so grateful that you're both here to share your perspectives and encourage and motivate and empower other patients and families who feel like maybe this is impossible. You're shining examples that not only is this not impossible, but this can be a baseline of a thriving life, not a normal life. So thank you for joining us on our podcast. I can't wait to follow up with you. We'll have to do our own kind of podcast.
Absolutely.
It would be great.
Absolutely.
And I'm so thrilled to have both of you here.
Thank you for having me.
And Mia, can you share with us where we can find you on social media?
Yes, so I'm on Instagram, TikTok, and YouTube at Allergies with Mia. I also just started a podcast as well called The Food Allergy Brain, which is bridging the gap between food allergies and mental health. And that's on The Food Allergy Brain on Instagram and on YouTube and TikTok as well. So,
amazing.
Yeah.
Amazing.
Where can we find you?
You can find us at FPIES on every single social media platform, from TikTok to Facebook to Instagram. And you can also follow us on LinkedIn.